Well, the arts program was the first in the United States, actually, in a hospice setting. And it was founded with the premise that we need to give quality of life to our patients, and we need to give them dignity through expression. And if you can't express yourself, your dignity is somewhat limited. We also try to give control and autonomy in choosing to participate in any form of arts. It's a multifaceted program. We have therapists and non-therapists, and lots of volunteers also in almost all expressive arts that you can imagine, and crafts and writing and journaling and music and so on. The idea is that if people can choose whether to participate, they can choose what medium they want to work with, actively or passively. Their families can be involved too. And what we find is that we reduce a lot of the stress that families are going through. There's a tenet of hospice care, a fundamental tenet that the patient and the family are one unit of care. So everything that we do for patients, we do with families as well, if they want to. And then sometimes separately too. It's an opportunity for patients to tell their life story and emphasize the things in their lives that have been important, the joys, the career choices, the holidays, the family, the love, but also some regrets and some sorrows and some losses. When people are making art or listening to music or making music even, their guard is down, they relax, they're engaged, and they release, and it's a very cathartic process, obviously, but they release and reveal things that they might not have told other people, particularly in the medical disciplines. So we don't go in with white coats and we don't withhold medications or give them bad news. We're actually seen as somewhat escapist too and fun. So people actually live fully until the very moment that they die. They're active instead of passive. They're not lying in a bed waiting for that moment. They're actually feeling productive and making things, and they make gifts for each other through which they express their love. And they also say things through art in a metaphorical sense that are too difficult to say face to face. So if you imagine looking into the eyes of somebody you love and asking them what they want their funeral plans to be, it's a really hard question. People love each other and they protect each other. And through art and music, they can actually say some of those things in a backdoor kind of way, in a metaphorical, symbolic way, through song lyrics or through collage that tells the history. When music therapists go to a bedside here, for instance, to an old couple who've been married for 60 or 70 years, and they play the music that they courted to, or that was their wedding song, all those reminiscences start coming out. And so do the emotions, and that's very cathartic and helpful. And gradually, conversation starts, and they come forward through their lives. It's a trigger for the rest of their life story, and it comes to now. But then they've already started, and it's easier to go on.